And here we are. Hello to everybody, morning, afternoon, and evening, wherever you're watching from, live viewers. Hello to all the replay viewers. Hello to Lindsay Badger. Hello to Knowledge
Hey,
El Shabazz. And hello to Gemma.
hey,
How are you today?
not too bad, not too bad. Can't complain.
Good, good, good. Hello, Michelle. Welcome on into the broadcast today. Episode 17 of the Mental Health Hour. Moving right along on this. This is crazy that it's already 17 episodes. Um,
Mm,
from the first time I just decided to go live one day. Um, 17 weeks later, here we are. Today is an audience requested show. I got actually 3 requests for this topic of NPD, Narcissistic Personality Disorder. So y'all know, I do take into consideration any and all requests we get for topics on the show. I have a list working that I write down uh, any topic that's been given to me on other broadcasts or anything like that. Um, and we'll work through all of them. So please feel free to keep the comments coming and feel free to keep the suggestions coming forward to us, and we'll put together an episode on almost anything you want. So, that being said, we'll get into today's topic: narcissistic personality disorder. This is
mhm.
something that, I mean, I personally don't feel like I have. Hey, car hunger. I don't have a whole lot of knowledge per se on this uh, specific topic, but I went ahead and I did a good bit of research on causes, effects, treatment, everything that we cover on this show. Hey, TJ,
Hey,
and we'll get through. There's more than enough information here to get us through the hour, so I'm not worried about that. But please feel free in the comments section to keep this conversation going. If you want to touch on something that you don't hear me particularly talking about, or Gemma, then
mhm.
absolutely feel free to bring it up in the comments and we can discuss. But to start us off, Gemma, how would you define narcissistic personality disorder? What kick us off here?
Okay. So the main thing that I know about it is to have a can't speak. Put my teeth back in. Narcissistic personality disorder is to be. It's for somebody that needs lots of, I guess, praise. They like to have a lot of. They need to feel like they're needed and wanted, and can have an over inflated ego, I guess, or
Hmm.
self-importance. So
Yes.
that's the main
Um,
part of it. I'd just like to really quickly say someone has sent in something on the form. It just asks if it's truly anonymous, and yes, it is absolutely 100% truly anonymous. We can't see who sent it. So there you go. Sorry.
oh, thank you. Yeah, Gemma keeps an eye on on the form. So the
Mhm.
bio link, if Gemma, if you want to pop that in the
I'm just
comments,
fixing it, yeah.
yeah, you can submit any questions or anything to the show completely anonymously, or you can tell us your name if you want, and that's fine. We'll hit it um,
So,
during the broadcast or whenever. Hi, Veda. Welcome on in. So, yes, what a topic indeed.
yeah.
Narcissistic personality disorder is, uh, just that sense of entitlement. So I'll run through some of the stuff that uh, comes up if you just type in like a simple Google search.
Mm,
The old Doctor Google uh, will diagnose you with symptoms along the lines of uh, being depressed, I guess, when you're falling short of that perfect mark. Perfection is key to the narcissist. Yeah, an exaggerated sense of self-importance, which is kind of what you hit on, Gemma.
Mhm.
That sense of entitlement, jealousy of others that are getting more attention,
Mhm.
or jealousy of others for their achievements. Like if somebody achieves something you've been striving for a little bit longer, or however you may feel, that jealousy that sets in, and you can't be bothered to feel happy for them or congratulate them because it's not you.
Mhm.
You know what I'm saying?
Yeah.
Um, there's just an overall insecurity, shame, humiliation, among other um, feelings inside. Uh, oh, and when you do make your achievements, the narcissistic personality disorder has been known to exaggerate those achievements, I guess is the appropriate vernacular here. Um, you want everybody to know about it. You want, uh, you know, any ongoing issues or any personal achievements must be at the forefront. And if it feels ignored, like a comment or something, you have to keep putting it out there like, hey, please recognize me, notice me. Um,
Mhm.
do you feel like that's a good kind of overall collaboration, but an overall uh, symptom list?
Yeah, like an overview. Yeah. Yeah, definitely. That's covered pretty much the most part in a very summed up way. Yeah.
So we'll throw this up there first, just for a little
Mhm.
graphic. Um, the subtypes of narcissism: the covert narcissist, the cerebral narcissist, the spiritual narcissist, and it seems like we can break down any kind of what mental mental health issue with uh, different subcategories,
Mhm.
and we do that quite often on this show. Actually, uh, everything can be broken down into different subcategories. Did you have anything on any of these in personal experience or anything like that?
Um, I had it on my phone so I could read it easier.
Hey,
Just
Mom.
with me.
Hey,
Um,
Swift. Hannah. Welcome on in, guys. Des.
well, nothing. I
Nothing on
wouldn't.
this
Nothing
particular.
like specifically. I have seen like I guess videos and things that demonstrate these. There
Mhm.
is quite an extensive amount online, but those were like obviously way too long to show here. But yeah, it's definitely a way of breaking it down even further.
Absolutely. Um, so, like the covert narcissist, the self-effacing, the envious, the jealous, the very jealous
Hmm.
narcissist. That's the one if I were to identify, especially prior to my time at the rehab center, and when I was drinking heavily, I was a very jealous and envious person.
Hmm.
Narcissism super intersectional, difficult because many codependents exhibit the same internal struggles can depend on your right. Are you going to go inward or outward? Yes. Some mental health practitioners won't diagnose you either way. They see them the same. Yeah, this is Veda. This is one of those that in doing some research for this episode, I've taken notice that it's not new. Not the idea, and Gemma and I were talking about this a few minutes ago. The idea of narcissism in itself is not a new uh, term or anything like that, but
Hmm.
the narcissistic personality disorder, the um, what was the other one we just mentioned? BPD. Um, all of these learned or not learned, all of these conditions are now being recognized by the medical field as a mental health condition.
Hmm.
And you know, that the idea of that I feel like is kind of newer. For whereas you were just known as a narcissist before, now you have narcissistic personality disorder. So
Yeah.
in a way, that's striving for um, better treatment. Hopefully, recognizing these conditions will also allow insurance to cover, therapy and such. The mental health field as a whole is very hard to get anything insurance covered, um, and stuff like that. Like, trust me, I went through a runaround with insurance. Um, Last year in particular.
Mm.
And even today, some of my outpatient stuff is not covered. Uh, so it's really a matter of I'm not able to do something every week because I can't afford out of pocket
Mm.
that kind of money. But I can break it down to a monthly basis. That's more affordable, stuff like that. Hopefully, I think the idea of now recognizing these as mental health conditions will help with insurance and all of that. Hopefully, down the road. Hi, Captain Rehab. How are you? Um, but moving forward on some of the other subgroups, the spiritual, I thought that was interesting. You know, the holier than thou kind of approach. Um,
Mm.
you're just generally intimidated by others. Um, you know, when I think spiritual, I think of something slightly different, but I can see where they're coming,
Yeah.
with this subcategory. Um, and then of course, everybody knows the cerebral narcissist, the I'm smarter than you, I'm more important than you, I'm better than you, and you're going to know about it. Um,
Mm.
so spiritual narc, also known as the God, yes, the God complex, indeed. Um, Absolutely. The ego-centric personality.
Mm.
Good evening, and thanks for the HAPS Collab Award. Very awesome. I always love the new awards when they come through. I like seeing
Yeah.
the designs and what have you.
Mhm.
So, what causes narcissistic personality disorder? Um, Briefly touch on some of the causes. Obviously, the cause of NPD is generally unknown, um,
Mm.
but it has been broken into your. It's likely an environmental thing, from childhood on up. Just the excessive criticism or adoration
Mhm.
from your parents, guardians, grandparents, whoever may have taken care of you or brought you up. The excessive one or the other, excessive criticism or excessive, you
Mhm.
know, admiration, adoration, um, can definitely play a role in somebody's coming up with these narcissistic traits.
Yeah,
Um,
like, I was
it
looking at
all,
something. Sorry. I was
it,
looking at something earlier, and it said about like that, about how it can either be inherited that way or, like, because of the way, like, environmental, because of the way you were either brought up. Like, if, say, you are, I guess, maybe an only child and you are spoilt so much that then you believe that you are entitled to everything, and as you get older in life, it's like if you are spoiled that much, I guess nothing will be ever good enough if you're not getting that continuously.
yes, yes, exactly.
Mm.
That's the that was the forefront um, root of this. From everything I read, it was very specific that this is an unknown. It's unknown exactly where this stems from, but
Yeah.
these are the likely scenarios: the environmental, like we just talked about, all that spoiled, rotten, or just the over criticism. In your childhood on up. You're never quite good enough for your folks' eyes or your guardian, whomever. Tim, are you wearing makeup flawless skin? No, I just got out of the shower though, and I shaved for work tomorrow. So yes, this drives my wife insane. I don't have any beauty rituals or anything like that. She should never mind. Anywho, this isn't the show to talk about that.
That's
Anywho,
it's makeup tips with Tim.
yes. So it's also looked at as a genetic thing. They're looking into genetics being a key role in this. Like if your mother or father, that brought you into this world are narcissists, then they can pass that down to you through the gene pool. And the last thing that I saw was just a disconnect in the neuroscience. The connection between your brain and your behavior. So from thinking or what's normal and what's not normal, this, that, and the other. Just the misfire from the brain thinking that this overinflated sense of ego is a normal thing to live with. And that can be said about most any mental health issue, even alcoholism. That this is something that my brain thinks is normal to drink the way that I did, and it's quite the opposite from being quote normal. So anything, Gemma, with the causes? Did you see anything that I'm missing, or did you want to go over the 8?
Yeah, no, yeah, you can bring that one up.
Okay, I'll bring that graphic up. If you have it on your phone and want to go through it, that'd be great.
Yeah, sure. I can't. I'd have to get really close up to be.
Whoops.
Oh gosh. All right. Do you want me to read them out?
Yes, absolutely.
Okay. So there's the 8 categories they say to know before it's too late. First one being intensity, lying, over the top gestures, insisting early marriage, bombarding with texts and emails, like just constantly on and on, like not leaving someone alone. Jealousy, irrational behavior, refusal to let you speak to the opposite sex, demanding to know private details of your life. Like that can be like checking someone else's phone, like saying that you can't go out, can't wear that when you go out, can't speak to certain people, things like that. Control, telling you how to dress, how to behave, showing up to somewhere uninvited, again, checking your phone without permission, things like that. Isolation, insisting you spend time only with them, making you emotionally, physically, and financially dependent on them. So, like making sure that you have no control over any money, so that you haven't got any access to like the bank account and stuff, so you've got absolutely nothing. Criticism, calling you names, ridiculing your life and trying to brainwash you, claiming that they're the only one that cares. A very popular one is like, you'd be nothing without me, and if it wasn't for me, you'd be this, this, and this, and if we were to split up, you'd never get anybody as good as me. That's like a popular thing that I've heard. Sabotage, making you miss work or school, appointments, things like that. Hiding your keys, hiding money, destroying your self-esteem. Blame, making you feel guilty or blaming you for their problems, making you responsible for their destructive behaviors. And anger, so overreacting to issues, having outbursts that you can't control, threatening to hurt or kill you, and feeling afraid for your life. And they can start off really subtle, so that you can yourself not know that that's happening, to then really, really full on intense behaviors that are out of control, basically.
Yes. Yes. And let me go back real quick. Somebody asked if we're therapists. No, absolutely not. It's in all of the disclaimers. Just to let
Hmm.
you guys know, we're just two people that have lived through some mental health issues and displaying information. That's all this is. We always do, and especially with something like this, because there is narcissistic abuse out there,
Hmm.
that people live day in and day out under this abuse. We always recommend going and seeking professional help, whether it even be the police that you need. You, here at the Mental Health Hour, we're what you call something. We're a link.
Hmm.
Uh, we listen. We link you to the appropriate health help. Um, that's the long and short of this show. Because uh, because we have this wealth of information, and it's certainly more than I ever thought I'd know about any of these mental health issues. Um, we like to put any information out there that we can help with. Um,
Hmm.
but the primary purpose of this show is to look, listen, and link. Um,
Yeah.
and if anybody's experiencing any issues that they feel that they need some real help with, we can help you. We can get you in contact with the right folks,
Hmm.
um, and we can give you some information based on what's going on in your particular situation.
Yeah.
But we're not trained therapists by
And
any sense of the mean of the
sometimes
word.
just talking about it, like making it so that it's more normal to talk about mental health, is helping. It can only, I think, help the mental health situation by talking about it, by normalizing it, and by um like just talking about it and sharing experience, like, which is what we've both done, is share our experience, I guess, so that other people, I certainly find it more helpful talking to other people that have been through it,
Yes,
but that's just me. But
that
yeah,
is
you can.
sharing experience, strength, and hope is what gets us all through. Um, and like Gemma said, making everybody aware of these issues that, like Hannah said, there might not
Mhm.
be as aware of something called narcissistic personality disorder is really all we're aiming for. Keep the conversation going and keep uh, everybody in a good frame of mind. That's the end game. We want everybody to be happy, talk about these things, normalize it more. I read a passage today in my AA meeting that I led this morning that really struck home that alcoholism can be as it can be as chronic and as normal as any other diagnosis. So that's kind of paraphrasing the actual verbiage, but we really don't think about that along the lines of these mental health issues. Everybody that is diagnosed with any mental health issue or um, struggles with mental health, their own mental health or the mental health of a loved one, um, is always very ashamed. Almost, I don't want to say that's everybody, but they're very. It's the society thing that has um, put this shadow over this group of health, this mental health field. And if we can get out there and talk about it more, normalize it more, make it more on the forefront, then I feel like we're doing our job here. And
Mhm.
that I've said it a bunch of times in the previous Alcoholics Anonymous Step 12 work is sharing your experience, strength, and hope with others so that they may uh, be successful too. And not everybody's willing and open to talk about things. Not everybody realizes there is a problem in their particular life. or situation, and hopefully talking about these things really brings that to the forefront and gets people thinking, oh man, maybe I do need to investigate this, or something like that, and that also we want to reinforce that it's a completely normal thing, that just as normal as any other diagnosis. So don't be afraid of who you are, and don't be afraid to talk about things that are going on in your life with your mental health, because it is so important to stay ahead of your own mental health by talking and being transparent with others, especially others that are going through the same thing that you're going through. There's nothing better to reinforce that you're not alone in this world, which can feel so true most of the time. I can't tell you how many years I struggled thinking that I was just this, I was so alone in the way that I felt, and that nobody else, nobody else, I was broken. Nobody felt this way. Everybody else seemed to be so happy, and nobody is this depressed. And I can't possibly be depressed because look at the life I lead. I have a great job, and I have a beautiful home, beautiful family. But yeah, anywho, that was a little bit of a tangent, and I hope it rings true to some people. I hope that you take a look into the mirror, and at some point just realize that you are normal and you are okay, and we all need to stop being, or society as a whole could stop placing all this shame on mental health as a whole, and I think things would improve a lot. Anyway, that's my soapbox for the day. Did you have anything, Gemma, to add?
No, you really covered it well. And I put in the comments, actually, I think that's why we both do what we do, because there is such a big problem around mental health and such a huge stigma around it. And if we can just talk about it and even just help one person, and to be even just on this platform to help get people talking about it, even so that if just one person can reach out for help, or to help normalize it a little bit more so that people don't feel ashamed about it, then, even just with that one person, then that's one more than could possibly have been alone or taken a very different path.
Yep. And thank you guys for the awards and the subscriptions. We do this show every Wednesday for those of you that are new to it. Every Wednesday at 6 p.m. Eastern Time, 11 p.m. UK Gemma time. And it's been a lot of fun, just presenting some of this information, and the conversations. Thank you, Ella, for all the awards. Thank you, Joy. The conversations that we've started have been one of the best parts of doing this show. I've really enjoyed talking with the community after the broadcasts are over, and hearing from you guys. It doesn't always have to be in the comments section, and not everybody is always going to be 100% okay with sharing so openly, like anything that's going on. You know what I'm saying? So you can always pull us aside afterwards, virtually pull us aside on our DMs or whatever. And I love talking with the community about anything, further on this. And I'll always usually post some more information on my channel page here and throughout the social medias about some of the articles I read to prepare for the show. Going into coping, let's talk about that for a little bit, if you'd like. Would you mind running through this slide for us as well, Gemma?
Yeah, sure. Just pull it up so I can read it.
Sure.
Okay, so how to cope with, I guess it's more aimed at people who live with or know somebody with narcissistic personality disorder, and that's to identify the signs and symptoms of narcissism, which we've just discussed, really. Encourage them to seek help. That could be quite tricky because obviously they're not going to really believe or know that they've got that. But then encouraging them to get that help, as a narcissist, they will probably think, that they're not in the wrong, and it can be hard, very, very hard, that one. But anyway, set strong and healthy personal boundaries. So don't let them take advantage, and make sure that you in your own mind know what you will and won't accept from them, and don't back down, because if you do, then that's when more and more will come into play, and it can just, again, it'll just get completely out of hand. Don't take their behavior personally. Like, I noticed, like, the main difference with the narcissism and narcissistic personality disorder, it says with this, narcissistic personality disorder is a mental illness, whereas a narcissistic person wants to control somebody else. Narcissistic personality disorder is more about them being the one. And then just to practice self-care and do things that you enjoy, take time out for yourself, things like that. But I guess it's the really tough one in all of that is getting them to get the help for it.
Mm-hmm. And that's the same with anything. Reaching that point where you need the help. It's definitely the missing link in a lot of mental health issues. Feeling okay with the fact that you can't handle something yourself. And I can speak on the front of a firefighter. We are a stubborn people when it comes to us needing help. We are supposed to be the ones that are called on for help. If there's an issue or something going on in your house, home, life, you call the fire department. We come and mitigate the situation, whether it be medical or, pretty much anything. I've been on anything you can think of. So us being the helpers all the time, it really is hard for us to realize that sometimes we need help, and that's just that's the way that first responders, not just firemen, I shouldn't just single firemen, police officers, military, nurses, et cetera, et cetera. First responders as a whole, we are a stubborn people when it comes to reaching out and asking for help. May I suggest Dr. Ramani on YouTube for those of us dealing with and trying to understand NPD? Absolutely.
I was watching some of those videos actually before.
Yes, please. Any good content that you have related to the topic we're talking about, please feel free to share a link or whatever in the comments. Say again, what's the difference between someone who just may have a big ego and a person with a disorder? Gemma, did you want to cover that one again, or?
Yeah. So certainly with the narcissistic personality disorder is a diagnosable mental illness, and that is mainly about them needing validation, needing like I've got written down here, like it's an overinflated ego, but they need the validation, they need admiration. Like, say for example, a person will do something good, I guess, or say something nice about someone, and then they will be insistent that you see that, and if you don't, like, they will continue to bring it up and mention it, and like, oh, did you, because they need to have that validation, they need to have that praise for whatever it is that they've done or said, and they need to have that. Like, I know some people that would meet this criteria, and they are constantly looking for approval from everybody, and admiration, and they have to feel very important, and they feel superior to others, and generally they actually have very low self-confidence and self-esteem, which is why they need to get the praise and encouragement from other people. Whereas someone with just like a big ego, like, I don't know, I think they just think that they are the big
So
I am really important, like.
really, the long and short of the answer, Michelle, to be classified with the disorder, you have to be medically diagnosed
Mhm.
by either a psychiatrist or medical practitioner. Meeting a certain amount of criteria, I'm not sure exactly what the criteria is, but I can definitely look that up and post it on my channel page and socials after the episode. But just like PTSD, we did an episode on being diagnosed with PTSD, and the criteria that you have to hit on to gain the diagnosis of PTSD is rather um, strict, and there's a lot to it. There's a lot that goes into it. Hey, Jim, thank you for the high award. Well, happy Catalyst Wednesday to you. Um, but yes, there's quite a bit of uh, criteria you have to hit on to get to achieve that PTSD diagnosis. So just the same with narcissistic personality disorder, you have to hit on a few things. And yes, like I said, I'll be happy to put that out on my socials after this episode. That way, we can talk further about it. But certainly, the inflated ego. I think we could all probably identify with that in some way, shape, or form. Um, you know, maybe not to the point of such an exaggerated sense of self-importance like this is calling for, but you know, uh, certainly there is just
And
the
sound a
folks
little
that.
bit here if you want, just really quickly. It is only
Oh,
really quick.
sure, yes, absolutely.
So it says causes. This is Mayo Clinic. Causes, so like environment, mismatch in parent-child relationships with either excessive adoration or excessive criticism that is
Yeah, we hit
poorly
that.
attuned to the child experience. Genetics, so inherited characteristics. And then neurobiology, the connection between the brain and the behavior and thinking. And
Yes.
then to get a diagnosis, it says that you need to meet most or all of the symptoms here, and it's like there's quite a list. Exaggerated self of put my teeth in. I can't speak today. Exaggerated sense of importance, sense of entitlement, require
Yes.
constant excessive admiration, expect to be recognized as superior without achievements that warrant it, exaggerated achievements, be preoccupied with fantasies about success, power, brilliance, beauty, or the perfect mate, believe they are superior and can only associate with equally successful special people, monopolizing conversations, belittling people, looking down on other people they
Hmm.
perceive as inferior, expect special favors, taking advantage of other people to get what they want, inability or unwillingness to recognize the needs and feelings of others,
Hmm.
be envious of other people and believe that others are envious of them, behave in an arrogant or haughty manner, becoming across as conceited, boastful, and pretentious,
Hmm.
or insisting on having the best of everything, for instance, the best car or the best office or the best home. So you have
So
to meet
does it
nearly all
say
of
you have to hit all of these, or you
them.
have to?
Not all of them, but it says that they would meet most of them.
Yeah. So
Uh,
that was much like the PTSD thing. You had to hit
mhm.
2 out of 6 of these categories, and then 2 out of 6 of this category, and then 1 out of 5 of these, and 1 out of 5 of these. So there was quite a list of. I'll take a look for that, but yeah, um, definitely has a nice list there of what you should be looking for. There's a confusion often between ego and vanity and the actual personality disorder of narcissism. Yes, I think that's kind of what Michelle was touching on there a little bit as well. Did you do an episode on PTSD, by the way? Yes, we did one of what's going to be many. PTSD is such a wide range topic that we've broken down some of our episodes into parts, part 1, part 2. So we have touched on PTSD in a previous episode, all on the Mental Health Hour channel if you want to catch the replays without having to sift through all of my channel page. We can put that in the chat as well. Gemma is envious of my cowlick in my hair. Captain Rehab. It's good to see Captain Rehab.
Absolutely.
So treatment, we haven't really touched on any kind of treatment for this. So I found this interesting, being as that it is HAPS Collab Week. Kind of what they want you to do in, I guess, if you go speak with a therapist or what have you, they're going to suggest improving collaboration with coworkers and peers. So trying to put yourself out there more as a team player than not feeling this, jealousy in it and envy all the time over your coworkers' successes. I think I started to talk about it. I don't feel like I finished what my thought was earlier. But when I was drinking, back when I was drinking, it was definitely I was a very envious person. Clearly because I saw my coworkers, surpassing me and doing things quicker than me because I was too busy, with my world outside of work that was involved drinking. My brain was over here and theirs was more focused on getting things done. So then I sat back and I was jealous that they got things that I didn't get, ahead of me. And instead of being congratulatory, or maybe just being congratulatory on the face as a facade, I was very, very envious of my coworkers. So improve collab with your coworkers and peers. Being more of that team player. I'm sure there's the therapy can give you some exercises to work on this part of your personality. Coping with self-esteem issues. That's going to be a big one. The ego and your own self-esteem. We all struggle in some way, shape, or form with our self-esteem. Some more than others, but I feel like it is something that we can all identify with, is some self-esteem issues. Excuse me. We got to understand our feelings. That goes along with any mental health topic that we can discuss on the show. Any diagnosis you can get in the mental health field, you're going to have to come to terms with you as a person, your feelings, understanding what they are, understanding what they mean, understanding why you feel the feelings that you feel, and then managing them. That is the world around mental health, the world around. That is one of the keystones, is understanding who you are and understanding how to manage who you are. Once you understand who you are, and once you understand the feelings that you're feeling, learning then how to manage them. Of course, there's always going to be self-improvement as well. Just taking a look at yourself and the areas in which that you can improve, in any area that you can improve upon. Whether it be collabing with peers and coworkers, or simply just saying that you are important and that you your self-esteem, putting your self-esteem in the forefront, that could be self-improving, and all of these self-care things that we talked about are very helpful along those lines as well. Just doing stuff for you, and
Mhm.
and sometimes putting yourself before others is necessary in the mental health world. um, and it's not a selfish thing to do, um,
Mhm.
especially in my line of work. I'm no good to you as my patient if I'm not good myself. So I have to take care of me before I can take care of you. Um, Otherwise, I'm doing you a disservice, and then learning. This is a big one. Learning to tolerate criticism. We can all say that we have a problem with criticism. Constructive criticism or not, criticism is hard to hear for the average folks.
Mm.
Um, we don't like to think that we're doing anything wrong or can do anything better. But really, it's something we all kind of struggle with. I feel like criticism is tough, and learning to manage and tolerate it
Mhm.
can really go a long way in your own mental health and your own um, self-esteem. Would you agree, Gemma?
Yeah, yeah, for sure. And taking the criticism as constructive. I mean, as long as it is and it's not like what we talked about earlier, but to accept it and I guess use it for self-improvement, you know?
Hmm. Yeah. Um, and also, Michelle, I forgot to mention. I think that it's important to mention that people with an undiagnosed narcissistic personality disorder, let's say, um, so looking at the symptom list, we're not going to think that there's anything wrong with us, right? Because that wouldn't fall in line with our narcissistic personality, right?
Mhm.
So the folks that it's kind of a catch 22, right? Um, you strive for this perfection, right? So and you don't see anything wrong really in what you do. So to ask for help for something doesn't seem like that's ever going to happen. So usually folks that have narcissistic personality disorder, they don't go into their doctor's office or therapist or psychiatrist and say, "Hey doc, I think that I have narcissistic personality disorder." Then they're usually they'll go in seeking help for things like substance abuse, depression, anxiety, and those types of things. Not understanding fully where the anxiety, where the substance abuse is stemming from, and really it's stemming from this narcissistic personality disorder. So getting to the root of that is going to fall on the psychiatrist as well. Um, or the therapist or whoever you were to go see. But certainly, if there's any issues in your life with depression, anxiety, substance abuse, please seek proper help. And you can reach out to me, reach out to Gemma, and we can get you in touch with anybody. I have quite a list of help, in my general area and some of the surrounding areas
Mhm.
uh, for my side of the country. And
Yeah, I'm the
yeah,
same to
so
my side.
yeah, it's just one of those things that we've picked up along the way. And yeah, so I mean, you're not always going to go in thinking, man, I have narcissistic personality disorder. You're going to go looking for help based on your depression, and your depression might be stemmed back to this, and they'll uncover that along the way. It's part of the process. It's part of understanding you, like I was talking about earlier, just getting a better view on yourself and understanding what your feelings are, and then how to manage them. So yeah, I thought it important to hit on that, and don't be afraid to say no to drugs. They may want to put you on antidepressants, etc., as this is not always. Yes, Lenny, that is 100% a personal
Mhm.
choice. You know, I've talked about antidepressants on here before. I take antidepressants, but the most important thing, if suggested, um, antidepressants can be a wonderful tool, but I 100% believe that you should be prescribed antidepressants by a psychiatrist, not by your general practitioner, not by,
Yeah,
just
that's true.
a primary care physician. This is a drug that is for your brain, and it should be prescribed to you by a doctor of the brain, or the psyche. So 100%, if you're going to go that route, I would highly suggest talking to a psychiatrist for that
Yeah,
kind of.
definitely. I have
Um,
experience with being prescribed them from a GP, and they certainly don't, because they
Hi,
don't have a
Pamela.
much understanding of it. They don't generally get what's right for you. So
Yeah.
definitely recommend going to
Yep.
someone specialized.
That's what they're there for. Psychiatrists are there to prescribe medicine for the brain and for your mental health and what have you. And
Mhm,
it's not one of those things like you have to go to a counselor once a week or once a month.
mhm,
Um, the psychiatrist appointment is usually 1 or 2 appointments, and that's it. You lay out what's going on, what you're feeling, and they can prescribe you a medicine or a plan of action based on what you've told them.
mhm,
And then usually there might be a follow-up appointment to see how the meds are, or to see how your plan for you know attacking any mental health issues in your life is going. And that's all the more you need to see a psychiatrist for. Because after that initial visit and after the checkup, then from there on out, your primary care physician is more than capable of refilling any prescriptions. But at
mhm.
least you made that uh, initial diagnosis and initial prescription through a psychiatrist that's trained um, in these fields. Absolutely, Michelle. Love doing this show. It's been an absolute blast so far. 17 episodes. I can't believe it again. 17 weeks of the mental health hour. It's crazy because some drugs may be contraindicated. Yeah, that's the other thing. Absolutely. Um, you, drugs all have indications and contraindications. And what that means is that a contraindication is something that we cannot give you a medicine for. Like if I'm on the ambulance, I can't give you nitroglycerin for chest pains if your blood pressure is the systolic, the top number is under 90, because it's not going to work for you. It's not a good thing. It's going to tank your blood pressure even more. So if your
Mhm.
blood pressure is 30, then it becomes contraindicated. So that's all that means. And that's absolutely right. Not all drugs are for you. And
Mhm.
another reason to visit a psychiatrist on these issues is certainly for that reason, because what works for my body, what works for my brain, my mind, body, soul, is not going to work for, let's say, Gemma.
Mhm.
We're all different people. We're all built differently, and we're all wired differently. And so not every drug is going to work the same for every single person. You know what I'm saying? So that's where that checkup, after you get the initial diagnosis from your psychiatrist and the initial prescription, they're most likely going to want to see you again for a follow up, just to see how things are going, because it's okay to say, look, this is making me feel weird, or this is not good at all, and then you go and you readjust. And it's just a matter of, that's the way it is with the brain.
Yeah.
um, but yeah, did I hit on everything there, Gemma?
Yeah, I'd say so. Like, mm, yeah, I've certainly had experience where I was given an antidepressant and it reacted with something else because the GP that gave me them didn't have the understanding of the drug.
Hmm.
And
Yeah.
It can get quite
That,
messy.
that's why, yeah, that's exactly why. General practitioners or primary care physicians are they're a jack of all trades doctor. You know,
Yeah.
they can listen to a list of symptoms about anything. They're going into one patient who has COVID symptoms, and then the next patient they see has a broken arm. Like, so it's just all over the spectrum. Whereas, psychiatrists is specifically trained in this type of medicine. So
Mhm.
let's do a quick review before we wrap it up here.
Mhm.
Um, Narcissistic personality disorder is what we covered today. Basically, what is that? It's that exaggerated sense of self importance. It's that entitlement. It's jealousy of others for their achievements, being envious of your coworkers, being envious. And this, we're talking all of, these are exaggerated things. It can be perfectly normal to feel a little jealous about somebody else's achievement. Um, but when it over encompasses you and it just envelops you and that's all you can think about. Now we're talking about, there might be a little bit of an issue. These folks like to monopolize conversations, belittle people that they look down on. They feel easily slighted. They're insecure. um, Again, all exaggerated forms of these. um,
Mhm.
we can all feel a little insecurity every now and again. That's
Mhm.
normal. But when it controls your life and your happiness, then that's when we're talking about maybe going and seeking some additional help.
Mhm.
Um, People that suffer from this can be abusive. We mentioned before earlier that, and perhaps we'll do an episode coming up with somebody that has a story to tell from being in a relationship with a narcissist,
Mhm.
having another guest on in that sense, as far as that goes. And so these people, uh, while they can be abusive and domestic abuse and all of that, we need to keep an eye on our friends, keep an eye on our peers, keep an eye on ourselves. And if the cops are warranted, please don't hesitate to call for help. Um, just wanted to stress that
Yeah.
any type of abuse is not cool. And, don't be afraid to reach out for help, even if it's reaching out to somebody for help and maybe they are able to put you in contact with the correct authorities or the correct folks. Um, People with NPD don't normally seek help for this condition as they don't see that there's anything wrong with themselves. They
Yeah.
usually go in seeking treatment for substance abuse, and I just mentioned this, depression, anxiety, etc.
Mhm.
So finding the root of all depression in your life might, they might come back to NPD as a diagnosis. So that's kind of how it gets diagnosed. Like I said, I will put some further reading and information on my channel page here on HAPS and on Twitter and our Facebook page and all that stuff
Mhm.
for any further information that you want to, or further reading. And certainly for Michelle, if I find anything on the exact criteria they use to diagnose NPD, I'll forward that along as well. And then the causes, obviously, the general cause of NPD is unknown, but it's likely an environmental thing,
Mhm.
like an over excessive criticism, excessive adoration. It's a genetic thing they're looking into, and there's just that disconnect in the brain that's always there for most mental health issues.
Mhm.
Um, and that's about all I have for the episode. We're right at the hour mark. Did you
Mhm.
have anything to conclude with, Gemma?
No, to say you thought you didn't have much on it, you've done really well because you really have summed it all up. No.
Thank you. And thank you for
Mhm.
your continued work on the show
Yeah,
and
yes.
supporting me, as I found it was quite difficult to run the show by yourself. It's definitely a
Oh
two-person
no,
show. So
I
you
said
filled,
I enjoy it, and I appreciate you asking me.
yeah, absolutely.
Yeah.
Well, every Wednesday here on the Haps and broadcasted out. So please don't forget tonight is Catalyst Wednesday with Jim in Chicagoland, 11 p.m. Eastern Time, 10 p.m. Central. Fire pit or candle, depending on the weather. It's raining here tonight, Jim, so I don't know how it's looking in your neck of the woods. But one of my favorite broadcasts on the platform, Catalyst. Come talk with Jim, talk with all of us, community, and wrap up the middle of the week here on Haps in Chicagoland. And after that, maybe Ella and I will have some fun. Who knows? But alrighty, guys, thanks for tuning in. Thanks for all the awards. Thanks for all the subscriptions. We'll keep the content coming. Please don't be afraid to reach out for help if you need help. You can even reach out to us and we can get you linked with appropriate help. And we'd be more than happy to give you any further information. The bio link is in the chat. And we'll see you guys next week, next Wednesday at 6 p.m. Eastern Time, 11 p.m. Gemma time. Bye now.
Bye.